about back pain?
So I think that's probably number two after knees of what we treat. A lot of people have low back pain in this country. Sometimes it's back pain with sitting, sometimes it's back pain with activity, sometimes it's pain that's running down the leg. That's a pinched nerve or some type of spinal stenosis, a tear in the disc, arthritis. These are all the things that we treat in the back. Usually we're treating the region. We're not treating a spot. We're trying to get the whole lower back better. Usually treating, for example, L3-4 all the way down to L5-S1. All of the arthritic joints, the loose ligaments, around the nerves that are inflamed and causing pain down the back. We have really good success with back procedures. As a matter of fact, most of the time we don't even need to use stem cells. We can use just concentrated blood platelets, but done in a very particular way, can be highly successful. I actually had a history of low back pain that was really limiting, had a procedure done, and thankfully I'm sitting here without any pain.
Now, but if it's a bulging disc, and I don't pretend to know about this at all, but I want to tell you, so if it's a bulging disc, stenosis, it's pinching a nerve, how is injecting stem cells going to make that pain go away or move that disc away from that nerve? So it's causing the pain. I mean, help me understand.
Yeah, I mean, that's a good question. A lot of people ask that question. They really are thinking like a mechanical. They have a mechanical mindset.
Yeah, like I have a bulging disc. So how is this
You're
going to
thinking
help?
like a carpenter, right? So this is pressing on this, and you got to remove it from that. And to some extent, that's true. But there's a lot of biology happening there. In other words, the nerve is under pressure, so it becomes swollen, and that swelling makes the situation even worse.
Okay.
Okay. So what we want to do is help that nerve recover, get rid of the inflammation so the nerve has more space.
And that's what this does. By injecting the stem cells, the nerve calms?
It calms down. It helps it to tolerate that pressure better. So, for example, if you put cortisone around the nerve, you're going to find that nerve is going to feel better as well. But the disc doesn't change any position. It just gets rid of the inflammation. The problem is cortisone weakens the tissue, makes the situation worse in the long run, affects the rest of the body. So, and there are some situations where we do see the bulge actually retract, especially if we go in a disc and put the material there, it'll tighten and pull back. But that's really not necessarily the goal. The goal is to get that nerve to calm down, to get the rest of the structure stable so that it's not so many odd forces and shearing forces on that disc. That disc doesn't tolerate this kind of a movement. It only tolerates pressure, compression. So we want to get the whole structure tight. Like if you had a fusion, that's what you're trying to do, is keep it from being unstable. But we're going to do that naturally with strengthening
ligaments. So it's like a
ligaments.
natural fusion in a way.
Well, we're trying to get it back to its normal function, which is tight structure, tight ligaments, moving in a particular way, taking pressure off of the disc, off of the nerve, helping with the arthritic joints. It's kind of a global treatment. We're treating a lot of different structures in the back. I really like our lumbar procedures. They work really well.
And the results, I mean, you've seen people that had low back pain for maybe 10 years and now it's gone?
I'll give you an example.
You ever had that?
Yeah, I've had this one guy. He's got really advanced spinal stenosis. He couldn't stand for more than 30 minutes. And he was retired, trying to work a part-time job in a department store, and he couldn't do it. He had to leave that position or take temporary leave. He came to me, and we did a lumbar procedure, and he went from being able to stand 30 minutes to now being able to stand about 7 to 8 hours before he really needs to rest, and he can go back and do his part-time job. I mean, he's functioning quite well. Occasionally, he needs to come back in and have the procedure done again, but we're talking about a really advanced condition.